but probably not perfect.
Speaking of the FDA, they just approved a device.
Well, they did. And, it's an innovative device for treating dry eye. We wanted to learn more about it, so we spoke with Dr. Alan Carlson, professor of ophthalmology at Duke Medical School and chief of the Corneal and Refractory Surgery Service at the Duke Eye Center.
Welcome to the People's Pharmacy, Dr. Carlson.
Oh, thank you very much. Thank you for having me.
Dr. Carlson, we keep hearing about dry eye syndrome. What is it, and why is it so common these days?
Well, it is a number of different things. It's really what we would call a heterogeneous group of patients. And for a long time, we thought that dry eye patients simply were not making enough tears, and that's caused us to prescribe things like artificial tears and Restasis. But a more recent, updated understanding has allowed us to recognize that there's really more of an evaporative component than we previously recognized, so that where we previously thought that there were not enough tears, many of these patients actually do produce enough aqueous portion of the tear, but there's a lipid abnormality that causes a more rapid evaporation of tear film. And this is something that gets worse not only by getting older, but things like diet, lifestyle, prolonged reading, watching TV, computer usage, all the things that we do more commonly now than we did years ago seem to be factors in making this a more common entity.
So this lipid component that you're talking about, this is like a little film on the surface of the tear?
Yes, traditionally we've thought of the tear film as having three different components. The innermost component being what's called a mucin layer, which contributes to the wettability of the middle layer or the aqueous layer produced by the lacrimal glands. However, there's an outermost layer produced by these meibomian glands, these little glands that line the upper and lower eyelid. These are variations of what are called sebaceous glands, and they put a very small lipid or oil component into the tear film, which stabilizes the tear film, reduces evaporation, and reduces our need to blink frequently. What we find, though, is with things like prolonged computer usage, staying up late at night, watching TV, these kinds of things where the eye doesn't get the normal rest and the normal blink frequency, along with our American diet, we get a disruption of this lipid surface layer, and it makes us feel like we just can't get the eyes feeling right.
Well, Dr. Carlson, explain what that's like, because for people who have never experienced dry eyes, what we're talking about seems all very esoteric and theoretical, but for people who are going through it, it's painful.
That's a great point, Joe. In fact, if you ask patients how their eyes feel, it is rare that they will tell you that dryness is their number one symptom. It's usually something like burning or foreign body sensation or a grittiness or just a plain, vague, hard-to-describe discomfort that's just hard to get rid of, typically gets worse toward the end of the day.
Well, tell us about this new device, this new system, if you like, that has just been approved by the Food and Drug Administration to deal with this thing called evaporative dry eye.
Right. Again, the term evaporative dry eye relates to the people that have this derangement or dysfunction of the lipid layer. And the new device, the LipiFlow unit created by Tear Science, is a device that helps express these glands that get clogged up and then create this abnormality in terms of lipid in the tear film, both in terms of quantity and quality of lipid. This disruption is something that has taken decades to develop, and so it's difficult to kind of return things back to normal. But this is the absolute best thing we have available now that can help these glands kind of rejuvenate and return to a much more physiologic state like a patient may have had decades previously.
How good is the device?
Well, the patients that I've seen treated and have talked to, again, it's only been recently approved in this country, but the people that I've talked to not only appreciate a dramatic improvement. They may say something like, "This is the best my eyes have felt in years," and it's because we're attempting to return the physiologic state to a state that existed decades previously. What's been a pleasant surprise, though, is how long the effect works. Initially, we weren't sure. Maybe it would only last 6 to 12 weeks, but we're really finding it's lasting more like 6 to 18 months. And we're trying to look to see who we can figure out and predict who's going to get these long duration of improvement.
How does it work?
Well, it works initially by applying a gentle and controlled heat from the inside of the eyelid. So people notice that with this condition that their eyes feel a lot better if they use a warm compress, but typically when you're doing that at home, you're applying the heat from the outside. This applies from the inside, which is where the glands are located. So it's several times more effective at initially heating up the glands and softening the contents. And then there's a peristaltic application that causes these glands to be gently expressed. And this is in comparison to some of these other techniques that are being developed where you actually stick probes into the glands, and that can be much more traumatic to the gland and much more uncomfortable, whereas this is almost delivered like a spa treatment to the eyelids, where the glands are heated and then expressed and emptied and allowed to kind of return to a much more physiologic state where the oil can free more slowly and precisely into the tear film.
Kind of an eyelid massage.
Yes.
Dr. Carlson, thank you so much for talking with us on the People's Pharmacy today.
Thank you, Joe and Terry. I appreciate it very much.
Dr. Alan Carlson is professor of ophthalmology at Duke Medical School and chief of the Corneal and Refractive Surgery Service at the Duke Eye Center. If you'd like to hear more about the LipiFlow device, you can go to our website and listen to our interview with Tim Willis, president and CEO of Tear Science, the company that makes LipiFlow.